So I'm Josh Fader, and I'm going to talk briefly about developmental delay diagnosis and tools. We've had a lot of brief talks today. It's like the sweets. There's so many different kinds. You got a little taste of many different people's work today. That's San Diego, where I come from. It's very beautiful. You should visit. And you know, these are my disclosures like Jim did. I work at a lot of different places. I'm going to use a lot of pictures. The graphic medicine community does that to help with things like language and to communicate ideas. I didn't draw this one. Many people to thank. Dr. Ali Shar, the people at the International Network for Peace Building, including Siobhan and Pauline, the people with ECPC, Fielding Graduate University, my San Diego colleagues, and of course my wife Karen. The outline, very briefly, I'm going to talk about a method to treat stress in children and families that went into the field of autism and developmental disorders. In the field of developmental disorders, the method developed and evolved. The method changed assessment and treatment of developmental disorders, particularly autism. And the evolved method has now been brought back to the field of trauma and stress to help children and families. So this method of dealing with stress is much like Dr. Leckman talked about. It really is all about how self-regulation, being calm, and responsive care helps children under stress. The method is centered on one idea, a circle of intervention. That's something that you can take with you today. It's the smallest piece of meaningful interaction. So the child is doing something. The adult responds to the child's behavior, even though it doesn't seem like the child's doing much. The adult waits. The child responds, confirming that there's meaning in the interaction. So it's like three pieces, talata, yeah? In the 1980s until now, methods like these have been studied and used in treating autism and developmental disorders. You can see the child who is not with the other kids. And there's a similarity between kids with autism and kids under stress. In autism, your brain is hurting. In stress, the outside is hurting you. But in both cases, the child is upset and the parent is upset. And this method helps both, using this method of observing the child, then doing something to get in the way a little bit or to change things, and having the child respond. This can also happen with more complex conversations. You see a child with autism who's talking about his cars. What's the word? Karar, all over again and again and again. The doctor tries to talk about a different kind of car. The child's talking about his own cars again. We don't know if it's meaningful. The doctor tries again, and in time, the child actually takes some of that idea, closing that circle. The method changes assessment and treatment of developmental disorders, particularly autism. So the two main diagnostic components of autism are someone who has trouble with social communication, you see off to the side there, and narrow range of ideas. Here's one person who just flaps, and there's another person who talks about triceratops. That narrow thinking, if you've known people with autism, I'm going to show you a lot of slides of triceratops, right? So a child might talk about, in very big words, about, and have all kinds of interest in, you know, triceratops, and it goes again and 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 again, and it just doesn't stop. You know these kids? Yeah. And then there's my pictures of, those are dragon skulls in Northern Ireland. Anyway, it affects assessment. In regular assessment of people with developmental disorders, you get a history and a physical and speech and language, occupational therapy. Very important to get collateral data from family, teachers, and others, and longitudinal data, meaning you watch over time. That's getting collateral data, make the phone calls and look at the records. And you might get other assessments. You might get genetics, you might get an EEG, you might get testing, IQ testing. You might get autism-specific assessments we'll talk about briefly, and measures of social connection as well. The ADOS is the chief test that people use to look at autism usually. It's very common. It's got these different modules for different levels of verbal ability. We're actually looking at improving the training for people here in Nablus. It's very accurate in research settings, but less reliable in the clinic. If you're kind to the child does better on the test and looks less autistic. That's just part of the ADOS, where they blow bubbles. I recently published a letter, I'm publishing a letter in the Journal of the American Academy of Child and Adolescent Psychiatry that says to not just rely on ADOS. It's not enough. Too many people use one test, you gotta use more. And there's other scales like the Child Autism Rating Scale, which is very good, and some others as well. But this method changes that assessment. When you think about that interaction with the child, it really looks at being calm and connected and in a flow of interaction. And so there's a couple new assessments based on that. The social emotional growth chart, the functional emotional assessment scale, and we have a video coding scheme as well, where we code a brief video at home or school or clinic, and we look for that connection. It also affects treatment. Usual treatment has autism-specific interventions, speech and language, occupational therapy, educational planning, and medications. I wrote a book about medications, Kabiri, and I gave it to the clinic here. But the common treatments are usually deficit-based and trying to train someone to look normal. And if you actually do those, look at me, good job, here's your cookie, or say vroom vroom with the car, there are side effects. If you really learn to look somebody in the eye like that, it's not normal. If you just go like this with a car, you can't really play with other children. If you tell someone to say hello, say please, say goodbye, if the child just says hello, it's not useful, but that's much of our treatment. So this idea of closing those circles changes that treatment, where we pay attention to the child and the parent and all the individual differences and the voice of the child. And so here's a book from parents and children. I also gave this to the Institute as well from my friend Robert Nassif. When we try to calm a child this way, we stay with the child when they're upset. We might stay with them and help them regulate by just being present or by being empathic. We do not ignore the child. That doesn't help the child, and we do not punish the child. But when the child's calmer, we make more circles. And we build a flow of those circles because that helps the child to communicate and learn and problem solve. And so we observe the child, we wait, we gently follow the lead of what the child's doing, and then we gently add ideas. We build on that. And gentle persistence makes it better. There are many different kinds of autism-specific treatments, and the one that I've been doing research on for about 12 years is Project Impact. It's in between the ones that are very strict and tell you to be normal and the ones that are very loose and just follow the child with no goal. And we are publishing on this. I gave the books to the Institute as well on how to do this, and we'll get more training for them. But it's evidence-based, evidence-informed. We have grants for bigger studies. We just got $3 million on that. And we're going to be doing regional trials as well in the United States. So this evolved method has now been brought back to the field of trauma and stress through the International Network and through Pauline and others. The Media Initiative for Children, which really Paul and Pauline and others got started, we've added this to it. And our goal is when families are under stress or children are under stress, you see the parent, see one kid's hyperactive, one kid's depressed, one kid is angry and pulling hair, the other one is sleeping, withdrawn, traumatized, all of them. Our goal is that they should grow up so that they're building houses when we're old with a cane, right? And not becoming traumatized or radicalized. And this is just a quick cartoon of how we train the parents and the teachers in the toddler programs, which includes reflective practice. It includes support to the adults involved to problem solve. We're doing a controlled trial. 36 are getting the intervention and 36 families aren't in Northern Ireland this year. And we're measuring child regulation, teacher responsiveness, child social emotional ability, parent stress, teacher stress, and child empathy. It all starts with that circle. That's all I really want you to know. Somebody is always doing something, you do something, and you see if they respond. And it can help us to live together in safety and peace, even with our different perspectives. We can have 4 people in a room. They can be facing different ways and have totally different realities. This kind of methodology will help people to understand that and work together to make peace. Shukran.